I want to thank the organizing committee for inviting me. That is the outline of my presentation. And just by way of introduction, I want to just emphasize again that we have come from very far as regards One Health. Mr. Chairman, allow me quickly to look at a few stories. We are current on the Ebola outbreak in West Africa. This outbreak caused the highest mortality of Ebola, higher than all Ebola outbreaks combined. And it cost, in estimate, $2.8 billion US dollars. So this is just to show us how, if we don't move and plan properly. This is the one, no? Okay, thank you. Yeah, if we don't plan properly, we can get this type of situation. I want to thank the gallant daughters and sons of Africa and the world who combined and really brought this outbreak down. Mr. Chairman, this is a very small case of aflatoxin, which many people don't know about. And in the East African community, we had USAID support to look at the problem of aflatoxin. And the session committee, the ministerial committee, sector committees of our ministers organized us to, including medics, agrics, nutritionists, to come up with an abatement program. And this has worked, and as I talk now, there's a lot of progress on aflatoxin. But I want to emphasize here that it looks simple on top here, just a small iceberg, but down the problem of aflatoxin is a serious issue. Mr. Chairman, we are all aware about trypanosomiasis. This is where I've worked most of my time. And during those days of the colonialists, especially in Eastern Africa, there was a serious problem of African trypanosomiasis. And the British government organized us, our people, under One Health arrangement, although the word One Health was not emphasized. But medics, entomologists, veterinarians, and biochemists, and other scientists worked closely and brought the problem of African trypanosomiasis to almost a halt. Uganda set up the Cockatoo office, the council, which has been coordinating this problem. And it works in a multi-sectoral, multidiscipline way, so that the issues of trypanosomiasis, which are in the wild, in the livestock, in the tsetse fly, and in human, can be addressed. Mr. Chairman, there's been a lot of work on One Health. And this just shows you the amount of commitments now. Now, you look at the publication levels. They have increased tremendously. These are publications, with America and Europe leading, and these are the professionals, with the vets, medics in the lead. What are the elements of One Health in disease prevention and prevention program? Mr. Chairman, infrastructure, disease surveillance, emergency preparedness, communication, and international agreements, issues of sustainable reporting mechanism, governance and legislation, legal frameworks with incentives, communication and M&E are very key. And I'm bringing this because these have socio-economic problems. Mr. Chairman, allow me to talk about governance in terms of One Health, and emphasize that inadequate governance or absence of it can cause a lot of problems if we are going to progress in One Health activities. Governance has those characteristics, which I will not emphasize so much. But when it comes to One Health concept, governance in terms of human and animal systems, there's need to comply with international regulations, standards and obligations to protect the people and animals against the major threats. And WHO and OIE have developed an operational framework which they have bridging tools for assessment of national capacities in terms of preparedness and in terms of surveillance and so on. And these tools are at 3 levels. One, for assessment, assessing, monitoring, assessing and monitoring. And OIE previous evaluation manuals, WHO handbook for assessment of capacities. These have already been developed and you can access them on the net. There is the costing tool for OIE and also the WHO International Health Regulations. And then the laboratory tools which look at the capacities of laboratories and their manuals, both in veterinary and human health. And they have also made synergies and complementarities. Now, when it comes to policy, Mr. Chairman, allow me to say that policies are very key if we are going to get funding and if we are going to get support from the politicians. But policies are the ones which give us strategies and action plans. But policies also must be supported by laws and regulations. Now, in East Africa, Kenya, Rwanda, Tanzania, and Uganda have already come up with strategies. But one should ask the question, on which policies and strategies are these strategies anchored? And what are the supporting regulations? If we want to make any successful policy, endeavor, we must have national level policies supporting legislations, and so that we can communicate, we can address community, social, cultural issues. Successful implementation of any program requires policies at the national level, intermediate level, and provincial, like Kenya and Tanzania, where they have provinces, and also at local level, at district level, like in countries like Uganda. And policies must be there must be addressed, must be informed by research. Now, research should inform policy, and Keyunze, in his articulation, said they must work on 2 legs. One, looking at natural sciences, and the other, the social sciences. So, Chairman, a framework like this of research can really inform. This is a loaded slide, but it's very simple. Research can inform. These are where the problems are in the animals, in the wildlife, in the human. And with good policies, you can really bring out good outcomes and address the global, the national, regional, and international goals, like improved. Now, socioeconomic, cultural implications of One Health. We need to see the linkages between issues of linkages and the socioeconomic factors, burden of disease and poverty, disease and the health care issues, burden of disease in cultural practice, and this should be surely this should be understood. We then can address, because we have problems at food and cultural systems, human and social ecosystems, and the natural ecosystems as we know in the One Health. And these are impacting on disease, emergencies, and the persistence. Now, on One Health, we must know that One Health is a public good at local level, at domestic, national, regional, international, or global. And issues are broadly conceived as important to at global level to the international community, because it's a global good, meaning that the time that the shared benefits between human and animal health are really the issues, and we need to know that because of time lag in this concept, because of time lag and its impact on means that management of global good of One Health have a long term, and we have to plan and build for the future. Mr. Chairman, because of being a public good, governance must boost the capacity of public authorities to manage goods, and there should be national and international commitment, especially for funding. The funding obligations for One Health are very important. At the national level, there must be commitment from our governments, and at the international level, the same commitment is important. Now, why invest in One Health? You ask that question. This is where One Health is, with the veterinarians, animal people pulling this side and the medical pulling this side. But it's important to see that the disease impact, the cost of disease in terms of production and livelihoods, the cost of controlling the outbreaks, human health issues, impacts, and what we could avoid if we planned properly are key issues. Now, this slide just quickly shows us if we work together. This was West Nile virus, and because of working together, the entomologists, the vets, and the medics, they brought there was a saving of 160. I can see here 160,000 euros, and overall 2.98 million euros. I'm about to end. So One Health benefits are there in terms of economic benefit, in improving human health, a higher quality of life, ecosystem benefits, and even personal and social benefits. And these are cases where these are studies which have shown real improvement, gain in terms of working together as vets and the medics, and E. coli here in Chad, rabies, and so on. As I end, I want to say that there are challenges. Challenges of disconnect between systems, especially between animal health and human health. There has been enthusiasm of funding at the beginning of the avian influenza outbreak, but now it is going down. There is absence of weak policies and weak political and budgetary commitments.